to a medical topic, which, all right, I'm going to ask you guys a question. If I said, tell me what a hernia is, do you guys know what that is?
Yeah.
You do know?
Pretty much.
Amelia?
I don't know, like, I couldn't tell you the definition, but
Yeah.
I know what it is, if that's okay.
So, and a lot of times I get these segments from patient interactions. So I was doing a tummy tuck the other day, and unbeknownst to me or the patient, she had a hernia. And so I, given that I was general surgery for plastics, I just repaired it. I don't call anybody in to do that. And so after she went home, of course, and then when she came back to follow up, I was like, oh yeah, by the way, you had a hernia. And she's like, what's a hernia? I'm like, oh. So I had to explain that. And so I do think that hernia is something that is a little bit of a nebulous term. And so I want to explain in this segment what exactly is a hernia, what does that mean, what are the types, what are the symptoms. So, all right, so so if you're gonna like try to make a definition for hernia, like the best way to say it is a hernia is defined as tissue, which can either be fatty tissue or intestines or potentially other organs, squeezing through a weak spot in muscle or fascia, and fascia is connective tissue, that it shouldn't be able to squeeze through. So it's basically when something in your body is going through a wall that should be a blockage there. And so, you know, if you have a hernia, it could be asymptomatic. Like a lot of people will come into my office and kind of spoiler alert to one of the hernias that's very common is umbilical hernias. We'll talk about different hernias, and like I'll be doing an exam for something like a tummy tuck. I'm like, oh, you have a little hernia. Did you know that? And like, no, I had no idea. In fact, I have a little one myself. I have a very, very tiny umbilical hernia that I can just barely feel. Like it's not anything big. I'm not gonna. I've considered maybe going and have somebody take care of it, but it doesn't bother me, so I haven't done anything. But the signs and symptoms that if it's not asymptomatic, then what you would feel is a bulge somewhere, like on your body. Like say, for example, my belly button. Mine's like really tiny, so and the only reason I know it's there is because I have the knowledge to know. If I didn't know, I'd never know it. But somebody who has like a bigger hernia would feel a bulge or a ball where there shouldn't be one. And it can change in size, like if you're doing something strenuous, like lifting weights. That's how I think I got mine, because I used to lift a lot of weights, and that intra-abdominal pressure pushes against weak spots. And once again, jumping ahead to a type of hernia, you know, the umbilical cord travels, you know, that's what your belly button is. It's the remnant of where the umbilical cord went through, and that seals up after you're born, but not always 100%. And so if you lift weights your entire life, or pregnancy, that's one too, increased intra-abdominal pressure, it pushes on that weak spot, and where it should seal up, it opens up a hole, and then stuff can get through it. And that's a really good way to think about hernia. So where do they happen? Like the abdomen is the most common location, and we're going to kind of go through these different types of hernia. And it can be a little confusing because you can have internal hernias as well, and the first one I'm going to talk about is an internal hernia. So this is called a hiatal hernia. I got a picture, Amelia, throw that up there. All right, so what we're looking at here is a cross-section of the chest, that kind of pink, broad muscle.
It's uncomfortable.
Yeah, so that's the diaphragm right there.
Yeah.
And so you see the stomach is both below and above the diaphragm, and it shouldn't be like that. The esophagus turns into the stomach, and that junction between the esophagus and the hiatal hernia, which is the upper part of the stomach, should be right where the diaphragm is. But what's happened is that hole where the esophagus goes through the diaphragm has gotten too big, and now the stomach is getting up into the chest cavity, like the mediastinum. And why that's a problem is because there's a natural sphincter there where that muscle is, and when you get a hiatal hernia, you get really bad reflux.
Yeah.
And so this is something back in my general surgery days that we would fix very commonly. We'd basically have to do surgery to fix it. You would usually do it laparoscopically with a scope, pull the stomach back down, and you would suture repair that diaphragm to prevent it happen. So that's a hiatal hernia. That's more of an internal hernia.
How does stuff like that happen?
So it's a natural weak spot there, right? So the diaphragm is a big, broad, thick muscle, but there's a hole through it because the esophagus has to travel from your mediastinum, which is the central chest area, into your abdomen, and there's a hole at the right there in the center where the esophagus goes through, and that's a weak area. And as intra-abdominal pressure increases, it's constantly pushing against that. You think of it like a seal, right? And just like the seals on like your car, like little O-rings and whatnot, enough pressure eventually can break that down. And then the intra-abdominal pressure is higher than the mediastinal pressure, so it's physics. High pressure to low pressure. So you're pushing something from a high pressure area to a low pressure area.
Right.
Does that answer it?
Yeah, I guess. But I'm thinking like more of along the lines of like a normal like an average healthy person's not going to get one of those, right?
I mean, it just depends. I mean, just like, you know, a new car, like a human body can have defects. I mean, and so, you know, you may not have as good of a seal around, you know, your diaphragm as the next person does.
Okay.
And also like your lifestyle. I mean, you're at risk for these, you know, being a weightlifter, you know, me too. It's like, I didn't have an umbilical hernia when I was a kid.
Right.
You know, it developed over years of lifting weights and, you know, that strain of, you know, when you're lifting a weight, you're pushing and, you know.
Do weight belts help?
Weight belts is more for protecting your back. Like it's the intra-abdominal pressure, like that Valsalva, almost like when you're having like a bowel movement, you know, you're pushing, like when you lift weights, you're doing that same thing. And so you're pushing on all of those potential weak spots in your abdomen. We'll kind of go through all the different ones, but it's the intra-abdominal pressure from that strain. So hiatal hernia, very common. That has to be repaired surgically. Pretty much all these have to be repaired surgically. Another big one is inguinal hernia. All right, so throw up an inguinal hernia. So this is where fat or intestine protrudes through the inguinal canal, which is a natural pathway that goes from the abdomen to the testicles in men. It carries the spermatic cord and the vessels and the round ligament in women. So there's a natural hole in the abdominal wall, which should be pretty small, because it really only needs to travel like blood vessels or in men and the vas deferens or ligament in women, sorry. And so there's a natural kind of pathway through there, and same thing, increased intra-abdominal pressure pushes on that natural defect, and you can actually get intestines going through. And so I repaired these a ton when I was in general surgery. More older people, you know, years and years of intra-abdominal pressure pushes against that. And how it feels is you'll get a bulge in your groin, like that crease. You know, the inguinal canal is basically right above like the crease of your groin, and you literally will get fat or intestine in there, and it feels like a bulge there, and it can be painful. You know, and
That looks pretty gross.
yeah, and so that also has to be repaired surgically. One very similar to inguinal canal is the femoral hernia. I think I got a picture of that one, Amelia, throw that one up. So you see that thing that says inguinal ligament. So the femoral canal is below the inguinal ligament where the femoral blood vessels come out. So that's an artery and a vein. There's a natural space there, and things can go in that. It's not as common as the inguinal. The inguinal would be above the inguinal ligament, and it actually travels along the ligament. The inguinal ligament is like part of the boundaries of that inguinal canal.
Can you still like detect it?
You can feel a bulge down low. It'd be a lower bulge. Those are pretty rare. I've repaired, went back in my general surgery days, like a few femoral hernias. They're not near as common as inguinal because I think it's a smaller tract, and it's harder for stuff to get through. Another big one is incisional hernias. So basically an incisional hernia, yeah, right there. So if you have surgery, and this could be laparoscopic surgery or open surgery, when you have surgery intra-abdominally, they actually cut the muscles of the abdomen, which is that layer that we're talking about that prevents things from getting through. And if, say, for example, you had an infection, then it would actually break down that muscle layer and make it vulnerable, and then you can actually get things herniating through where an incision was placed. And we see this all the time. These are actually very common. And of course, you know, there's risk factors for it. People who are heavier, diabetics, you know, smokers, they're more prone to have these incisional hernias. These ones can be huge because depending on the size of incision was made, like if it's a laparoscopic surgery, those incisions are small, but like if you have like an open abdominal surgery for, you know, like, I don't know, like you're in a car wreck and they got to take out your spleen, like that's a big incision. And you could potentially have like that whole thing open up internally and then push stuff out. And I've seen some crazy incisional hernias over the years. Like, I mean, stuff that where it's like, you know, they have just like loops and loops of intestine.
Is it common with like mommy makeover, tummy tuck things?
No, because in a mommy makeover, we're not going through the abdominal wall. Okay. In fact, we're repairing the abdominal wall. Yeah. You know, part of a mommy makeover is as pregnancy stretches out that abdominal wall, it gives that push to the abdomen. And so what I do in a mommy makeover is actually repair that and pull it together. So yeah, nice. That would be, that'd be something different. You know, mommy makeover is not going to give you a risk of a hernia.
Cool.
I do find hernias, you know, not uncommonly when I'm doing that surgery.
Yeah.
And, you know, because I have a general surgery background, I just fix them. You know, I don't call someone in to do that. And then the last one, and there are other hernias. These are like the major ones. There's like some really rare ones like Bldg hernias, and you can have like internal hernias where your intestines kind of loop on themselves. But the other really common one, which you've talked about, is umbilical hernia. Yeah, right there. And so that's the remnant of where the umbilical cord from your mom's placenta goes into you to supply the blood, and normally that shuts down, but there is a weak spot there, and either pregnancy can open it up, which is very common. I see a lot of women who are kids are coming in for a consult for tummy tucks or lipo or whatever, and they'll have like a little hernia. You'll feel like a bulge basically right at the base of your belly button. Like I said, I have one myself. Like it's really small, it's not getting any bigger. I'm probably not gonna do anything about it, to be honest. So like what can happen with hernias, right? So like what is the risk? Well, they can be uncomfortable.
Yeah.
You can have pain from them if they're,
Pictures definitely make you hurt when you look at them.
Yeah, you see the pictures like, that can't.
Looks
It
uncomfortable.
can't be comfortable. And so kind of the risky thing was with hernias if they get incarcerated. So incarcerated means that the stuff pushes through, but it can't get back.
I was like, they're going to jail?
That's right, you're in jail, buddy. But no, so we call hernias reducible or non-reducible. So if it's not reducible, I mean you can't push what's supposed to be on the inside back in. That's called an incarcerated hernia. And that becomes a little bit more concerning because it means that this stuff is now trapped outside, and then it can progress on to being strangulated, which means that whatever's going through that hole, the opening gets too tight and then actually cuts off the blood supply. Mm-hmm. And then people can actually have things like dead bowel, which that's a medical emergency. You can die from that. And so that's why hernias can be potentially risky. Now, if you have like a little tiny hernia, you're probably fine. But if you find a bulge on yourself, whether it be like groins really common or on an old incision or the umbilicus, it's probably worth mentioning to your doctor, just to make sure it's not something significant enough that's going to put you at risk. Like I said, mine, I know for a fact that, mine's so small, it's just probably just a little like omental fat or something that I have. I mean, it's like the size of a pea, like it's nothing.
Right.
But if that were to get bigger where you could actually get a significant amount in there, I mean, it could be potentially, harmful. And so I would, consider more about getting it fixed. But asymptomatic hernias are very common. Like I said, I see them all the time on women when I open people up for tummy tuck. All the time being, maybe 1 out of 20, I'll find a hernia. It's like, oh, you had a hernia. And normally it'll be, I always check them for umbilical hernias. We're the ones I find that I didn't know they had. It's like if they have an incisional hernia. It's from laparoscopic ports, really common. Laparoscopic port makes a small incision into the fascia, and then so for whatever reason it doesn't heal, and then something pushes through, and it's like, oh, you had a hernia. But so do you feel like I mean, you already kind of knew. Emilio, you know what hernia is now?
A lot more, yes. And you couldn't see me, but when you had those pictures up, I was just like, gross, this looks painful. I don't want to experience this. I had a friend,
you weren't about to go down, were you?
No,
okay.
I was fine. No, but I had a friend way back when he was lifting weights, and he had too much weight to where he gave himself, I think, 4 hernias.
Oh, wow.
Yeah.
That's crazy.
It was bad.
Yeah, I mean, lifting weights is a big risk factor. Like risk factors for hernia, I mean, it can just happen even without, having risk factors, but, pregnancy, weight gain, lifting weights, anything that increases your abdominal pressure, puts you at risk for hernia. Like weightlifters for sure, they're at risk. I know that's how I got mine.
Yeah.
Because I didn't have it when I was like in my teen years, and it just over the years of lifting, which I obviously am not like lifting right now. I look like a stick figure, but in my lifting days, I actually used to lift pretty commonly, and so I think that's
like with weightlifting too. What I've seen is that whenever you do have a lot of heavy weight, I always hear like you have to like basically flex or like prep your abs before you lift the weight.
Yeah, that might help.
And then that way, you don't really give yourself a hernia since you're flexing your abs. I guess it like pushes back.
It helps.
I'm not too sure. Yeah.
I'd have to look that up. I'm not sure about that.
A strong core is always helpful.
Yeah, strong core is good.
For lifting weights.
Yeah, for sure. Well, anyway, I think now at least people have a general idea what a hernia is. Like, I think pictures are helpful description. So, when you hear people have a hernia, at least now you like, because I remember like when I was like before I was in medicine, I'd heard the word hernia and like I had no idea what that was. I was like, I don't even, like the concept of it was just lost to me. Like when I was in college or high school, it's like, oh, Uncle, Cletus has a
hernia now.
Has a hernia, right? Yeah, and like I don't even know what that means. I have no clue what that is. So hopefully we cleared it up. People are educated on hernias. So let me know if you have any more questions about hernias, or if you ever had a hernia, anything experience you want to drop us a comment. we'll answer you. So.